Dr. Nigel Plummer, an expert in the field of probiotic research and innovation, has dedicated his life to probiotics, has published over 100 papers on the topic. His research and innovation has led to the successful Genestra HMF probiotic products. Dr. Plummer, what are probiotics?
Yes, well, in our bodies and on our skin, we have literally billions of bacteria. And some of them are good and some of them are not so good. And all that probiotics are the very best of those strains that we have living in us and living on us. And what we do is take them out and then put them back in higher numbers to have an increased benefit.
And how exactly do they work? How do they have this beneficial effect?
Well, what we think now is that they work in a number of different ways. We know that they, if you like, interact with our intestinal system, and we know that they talk to our immune system as well. So we see immune benefits and intestinal benefits. But now also, we see that this group of bacteria that we have in our GI tract talks to other parts of our physiology, like our endocrine system and maybe our neural system as well. So as well as immune and intestinal benefits, we're seeing that maybe probiotics as part of our microbiome have impact on our cardiovascular system, on our hormonal system, and on our neural systems.
Wow, so the proper balance in the microflora is crucial to overall health. What would some of the symptoms or signs be that your microbiome is out of balance?
Well, some of the signs, I suppose, that are most common are bloating, intestinal pain, and if you like, a disruption of bowel habit. So if your bowel habit has been relatively normal or has been the same for a long time, and then let's say you have a course of antibiotics, and then following that your bowel habit is somewhat different, then that would indicate that you've had some kind of intestinal effect. And the other thing is obviously gas. So gas, if you see, then that might indicate that you've had an imbalance in your microflora.
I see, so restoring this good bacteria, is this safe for us to do?
Yes, it is perfectly safe. And I mean, for example, we've done trials where we've been giving probiotics to healthy newborn babies daily for the first 6 months of their life. And there's no more vulnerable group than a healthy newborn baby. So yes, totally safe.
And I understand we can find probiotics in supplements. We can find them in capsules, in powders, in therapeutic dosing. What about probiotics in food?
If you're using or looking at a probiotic food, then go for one where there's clinical trial evidence for the condition that you're looking to have an impact upon.
And I'm sure there's variability in dosing. If you could comment on therapeutic dosing, CFUs, colony-forming units, what would be considered therapeutic dosing?
That one's difficult because for different conditions, then you'll need a different type of dosage. But for instance, let me indicate that most conditions that we're looking to have an effect upon, you'll be looking for anything from 10 to maybe 50 billion CFUs as a daily dose.
So something like Genestra's HMF intensive would have 25 billion CFUs, would be a good therapeutic dose for general health in restoring microbiome balance.
Yes, general health and also, I mean, that's exactly the product which we've used in a number of our clinical trials.
And how would we take a probiotic? What's the best way to take probiotics?
Well, I think that the sort of one guiding light really is to say that probiotics should be taken with food, and that is either just prior to eating, during the meal, or within half an hour of finishing the meal. It doesn't have to be a big meal, but it's really important. Otherwise, if you take probiotics on an empty stomach, then the acidity of the empty stomach can have a detrimental effect on the viable count, or the CFU.
And also, what about refrigeration of a probiotic? Is that necessary?
So although it isn't absolutely necessary to keep probiotics in the fridge now, the condition of the probiotic is always going to be better if it's kept at 4 degrees C.
Okay. So probiotic use, to recap, when looking for a good probiotic, look for one that has a clinical research behind that probiotic, the proper therapeutic dosing, and make sure that probiotic is specific for what you're looking for a health outcome. Ask your doctor or your pharmacist for a good clinically researched probiotic such as Genestra's HMF probiotic products, or visit soroil.com for more information.